Welcome to the T-Level Health Core Assessment Employer Set Project Task 1 Synthesis Task Overview. In this presentation, we will guide you through the details and key considerations for Task 1. Please remember that the information provided here is based on data available as of September 23 and may not reflect future changes to guidance documents. Always refer to the most up-to-date guidance. Task 1 is the synthesis task and it plays a crucial role in the ESP. Let's delve into the specifics. In this task, students will act as a supporting health worker within a multidisciplinary care team. Students' goal is to help achieve individuals' care goals following one individual's healthcare journey. Task 1 takes place within the 2-week assessment window and has a duration of 2 hours. Students will work under supervised conditions and have access to research from pre-release activity. However, students are not allowed to access the internet or any additional resources. Evidence submission for this task should be a word process synthesis report on supporting the individual. Understanding how Task 1 fits into the broader project is essential. 3 areas that this task links to are preparation research, Task 1 and Task 4. For preparation research, consider this as the foundation for all subsequent tasks. Focus research not only on the current brief, but also what will be needed for upcoming tasks. For Task 1, this is your student's first opportunity to synthesize their notes into an analysis of the patient's needs. Student justification starts here. For Task 4, questions that students may consider in relation to reflection on Task 1 are: did you use your pre-research effectively and build the foundation for your report? When completing your report, do you feel that you were missing key areas? As a result, were you prepared for the supportive discussion for your role play and then create an effective healthcare plan? Task 1 offers an opportunity to demonstrate various core skills, including CS1, person-centered care, when planning, developing and providing care to ensure the needs of individuals are met, and CS5, researching, being able to contribute to research and innovation within a specific area of practice, working from independently sourced material and analysing results of research to draw conclusions. To maximise success in demonstrating these core skills, students should consider the following tips. The report might identify or explain some of the following. Identify the individual's key needs. Identifies the individual's support network, e.g. carers, care team, family, significant others, for example. Uses evidence to justify each point or recommendation. Uses other appropriate and relevant sources for support and suggestions, such as the NHS website, Public Health England, Care Quality Commission. Makes links to relevant evidence-based practice, theory and policy. It's important to relate the information gained to the individual from the case study and discuss how to apply this evidence-based information to best support the individual. Use numerical details such as percentages, graphs, tables, and numerical statistic. It is important that students use numerical details to justify the support they are discussing for the individual with logical reasoning. They need to analyse how the information could be used to effectively support the individual and not just simply include the information as it related to an individual's condition. And reference communication barriers and justify any support required. It is important to understand communication barriers within health and how communication and support provided may need to be adapted or additional considerations considered when providing support. This will help to justify the support when referencing potential communication barriers. So now we're going to explore how to maximise student success using the Autumn 23 Grade A exemplar, alongside the descriptors for Band 3 and 4 marking criteria and the examiner commentary from the tasks to highlight key areas that can maximise success. Use this as an example process. This could also apply to the C and E exemplar, given a way to measure student achievement. The Chief Examiner's commentary on the students' works can be summarised and cross-referenced with grading bands and indicative content as follows. For content quality, evidence here was of a band 4. The report is thorough and well planned. It includes a wide range of relevant and appropriate resources, demonstrates a strong understanding of the subject matter, references are developed, meaningful, and relevant. For English skills grading band 3, the application of English skills is mostly good, sometimes reasonable, but not excellent. While there is good practice in summarising John's needs at the start of the report, there are areas of improvement in written English skills. For the exemplar structure and logic, there is evidence of grading band 3. The report uses headings effectively, but the progression of ideas is not consistently logical, and there is no conclusion in the report. For resource application, again, another grading band 3 was evidenced here. References were varied and enabled a holistic consideration of John's need. The student showed a good depth of knowledge. However, there were weaknesses in controlling and applying research materials with some generic sections. And finally, there was a grading band 3 evidenced in the numerical and statistical skills. There was an attempt to use numerical and statistical skills, but they they could be justified more effectively by relating the research to the case study. So in summary, the students' work aligns well with aspects of both grading band 3 and 4, with strengths in content quality and resource application, but weaknesses in English skills, structure, and numerical justification. The overall assessment is a comfortable mark band 3 for this task. However, you can clearly see criteria needed for students to maximise success and the opportunity to reach band 4. The key themes in task 1 of the Health Core Employer Set project can be summarised as followed. Overall, students produced work of a good standard for task 1. The quality of work was notably improved when students focused on their chosen individual and discussed specific details about the individual's condition and person's circumstances. Students who achieved higher marks considered the holistic needs of their chosen individual, incorporated well-researched information from various sources. This showed a depth of understanding beyond general information. The standard of work improved when students discussed their chosen individual in a specific manner, tailoring treatment plans to the individual's circumstances and condition. Some students effectively used statistical data and graph in the report. However, marks were only awarded when data was appropriately explained and applied to the context. Students who considered potential barriers beyond what was provided in the case study and proposed strategies to overcome them gained additional marks. Effective time management and evidence of thorough research were evident in high quality submissions. Some submissions lacked evidence of well considered research, and in some cases, reference lists were missed. Students struggled to demonstrate the higher order skills outlined in the indicative content required to achieve the higher marks available. And some submissions displayed concerning literacy skills and lack of proofreading before submission. So in summary, task 1 of the Health Core Employer Set project underscores the importance of focusing on the specific needs and circumstances of their chosen individual, conducting thorough research effectively using statistical data, considering potential barriers and demonstrating higher order skills, with stronger submissions showing depth, specificity, and well-researched information. Thank you for watching. We wish you success in the T-Level Health Core Assessments Employer Set project.